All right, and welcome to Deuk Spine Institute. I'm Dr. Deuk Majan. Our patient here is going to undergo surgery called the Deuk laser disc repair. She has some discs that are damaged in her lower back. And can we cut this light or do something with this light? Burn this? Yours, please? Yeah. Yeah, they just turned it off. It's fine. All right, do you see 5-1, Monica? I think we're off on WAG. Let's try to get the WAG better. Shot, just wag it 2 degrees, and that's better, I think. Is it? Yeah. I don't know, it looks worse, right? Shot? I don't know. Here, let me have control of it. Shot. That's definitely better. So move the whole fluoro south. South, 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 more. Shot. That's it, lock it in. Well, this will be a pleasure. It's got a very narrow space for me to work with. Let's drop the fluoro or bring the table up just half an inch. Shot. That's it. Shot. All right. Shot. This is going to be threading the needle, so to speak. Where do you feel that? AP?
Where are you feeling that? In your legs? Where?
In your back?
Where, in your back or legs?
Shot. AP, or sorry, lateral. Oh yeah. Well, you're doing good.
Where are you feeling that? All the way down your left leg.
Left leg.
Yes.
Still there?
You still have left leg pain? Yes or no? Left leg?
Shot. All right. Shot. I'm hitting her facet. Shot. She has scoliosis on top of everything else. Shot. Okay, off. Shot. Shot. I have to get around her facet. That's the joint in the back of the spine. Shot. I'm working on L4-5 right now as we speak. Shot. All right, go back to 5-1. Do you have any pain in your back or leg?
Where's your pain? Back or leg? Where? Back or leg? Back?
Anything down her leg, ask her.
Are you having any pain in your leg?
What'd she say?
In back.
All right. Shot.
That went down our leg right there.
How far down?
How far down is it going?
Shot.
How far?
Shot.
How far is it going? Down
Shot.
to your toes?
No, she just said oh.
All the way down the front of her leg.
Front of her leg. Ask her now.
Is your pain in your leg or your back? Where? Leg or back?
She's a bit hard of hearing, so.
Is your pain in your leg or your back?
Do you have any pain right now?
Starts in the
How far down her leg?
How far down? To her knees.
Not past the knee. The knee is the facet. Where now? Ask her where now.
Where are you feeling that now? All the way down?
To where?
To where? Down on her knee.
Yeah, so just her knee. Mm. Mm. Well. Where is she from? Melbourne.
She's right here.
Hmm?
She's right here.
Yeah. This is the diclofenac. All right, give me an AP. Let me have a coker. All right, the bottom one looks great. Hmm? 5-1 looks good. Let's see if we can make it work. Where do you feel it?
Where do you feel that? Down your leg to where? Past your knee?
Where? To where?
To where? Your ankle, your toes?
No, don't give her answers. Ask her where it goes
Where does
to.
it go?
To where?
From the back down to the knee.
Yeah, it's the knee. Where do you feel it? Where does she feel it?
Where are you feeling that? Where?
AP? That's fine. I mean, do what you need to do. I just have to have reliable information. So that's it right there.
Yep.
I mean, it looks good. It looks perfect on the AP. We're way below the pedicle. We're so close. Where do you feel it?
Where are you feeling that?
She's moving a bit too
Where
much.
are you feeling that? Where is that?
In
Where
her
is your
back?
ankle?
Is that in your back?
All the way down to her foot.
Her foot.
She just said that, yes.
Okay. Well, that's not good. Shot. Try to show me 4-5. I think. Shot. Shot. Man, with her osteoporosis, it's just it makes it really challenging to see. Shot. Huh? Well, they did. Yeah. She's not easy. She's not easy. Huh? Well, I'm concerned still about this oozing. So I'm just going to give it a little more. Where do you feel that? Don't move. Shot. All right. Let's get an AP. Raytech, you better get some more Raytex, my friend. This is not a normal Raytech case. Better get some more Raytex. Call for them now. All right, so 4-5 is not close enough. Shot. It's not terrible though. Where do you feel it? Shot. Shot.
Where are you feeling that? Where are you feeling that? In your back or your leg?
In her
Down?
back. In her back. All right, I'm going to try one more time at 5-1. See if I can get it. Shot. Where do you feel that? We're not anywhere near her nerve root. Shot. Shot. Where do you feel that?
Where are you feeling that? Where? Back?
In her back or down her leg? Ask her, back or down the leg?
Back or down the leg? Where?
Back or down the leg?
Back or down the leg? Back or down the leg? Where are you feeling it? Huh?
Num num.
What?
Where did she feel it? In her back or down the
Where
leg?
did you feel it? All the way down.
I know, but to her foot or not?
Do you feel it down to your foot? Where do you feel it on your leg?
Shot.
Where?
Shot. Yeah. Shot. Shot. All right. Shot. I'm sorry, I know. You can, we're almost ready to, shot. We're almost ready for her discogram. Shot. Where do you feel that? Shot. AP. I may not be able to do 5-1 because she's unreliable and she's not really giving us the information we need. And I'm encountering, she's giving me a lot of pain, but she's saying it's in her leg. Yeah. I can't really tell at 5-1. Let's pull up the MRI when you get a chance, but not right this second. 4-5 looks good. I'm happy with 4-5.
Should be right there, Mickey. Move up once.
Shot. Let's get some dye there. Looks like she stopped bleeding, which is good. So she had been on diclofenac. And are you okay?
You see it?
Can you hear me? All right. Shot. Good. So that looks good. Hold on.
Shot?
No, give me an AP. We'll try one more time on that 5-1. But you can see the bleeding has stopped, which is good. Shot. All right, that looks perfect. Perfect at 4-5. The only question is 5-1. And it looks like we're right there. I just really want to try to get it. You okay? Yeah. Looks like I'm right there. Where do you feel it?
Where are you feeling that?
What'd she say?
She said bad? That hurts really bad.
Is that in your back or your leg?
Your back? Where's that? Back or leg? Back.
Oh, good. Back is good. Well, we know that's a bad disc. We're going to fix it for her. Is that better? Shot? Oh, yeah. Good. We got it. All right. We can put her to sleep. That's good news. We're going to get all these done. I'm really happy for her.
Nikki, laser.
So it wasn't easy. She has a twisted spine, collapsed disc, spondylolisthesis. She's got everything. Kyphosis, scoliosis, listhesis, osteoporosis, facet arthropathy, the whole 9 yards. And yet, okay, guys, let's get this laser going. Huh? Everything. Coagulopathy, everything. I mean, heart, medical. And we're going to get this done. The good news is she's going to feel great. See how painful that disc was? I just touched it and she was howling. So I'm glad we're fixing it.
Gonna need a little bit of time here.
Take your time. Take your time. All right. Henry, shot.
Yes, sir.
We are going to shot. Come on.
Trying to get that.
Don't make this harder than it is. I need your cooperation and help. Did you get it? We're good. We don't need it.
Wrong with
We don't, yeah, well. You're fine. Henry, you can show our audience, why do these discs get so painful? What is it about the disc that's so painful?
Copy that.
Berndes, I'm right there, so I'll wait for your approval. Whenever she's ready.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals.
I forgot to mention osteoporosis. So she's got listhesis, spondylolisthesis, osteoporosis, facet arthropathy, degenerative disc disease, collapsed disc space, shot, and all of that is not causing her problems. It just makes the surgery harder for me to do. Her real source of pain is the two discs, as well as her SI joints and her piriformis. The two discs are hurting because she has tears, and those tears are full of inflammation. The inflammation is what's causing her pain. Inflammation is the basis of all pain. And it's the inflammation in these two discs that's causing her to hurt so much. Now, how old is she? 89 years old, folks. And she wants this done. She did not want to put it off. She wants her back pain gone. She wants to enjoy the rest of her life, and she should. There's no reason she shouldn't. Obviously, she creates some risk for us and her doing the surgery because she's older and she's got some medical issues, but at 89 years old, she's not the oldest patient we've done surgery on. We've done surgery on 95-year-olds. 93? No, we did a 95. I did. You may have done a 93. I did a 95-year-old patient, and you wouldn't believe what we did. We did a 4-level fusion. TLIF. Cages, osteotomies, reconstruction, and he walked out of here. At 95, 4-level lumbar fusion, L2, 3, 3, 4, 4, 5, 5, 1. I don't remember who the anesthesiologist was, but it may have been Dr. Santiago. Anyway, it took me 4 hours to do the surgery, and we lost maybe 100 cc's of blood. We were doing them every week, you know, these T-lifts, major T-lifts here, outpatient. Now we don't do those so much anymore. I would have done this surgery instead on him. But he wanted his insurance to cover the surgery, and his insurance wasn't going to cover the laser. So we had a fusion. His insurance didn't pay for that either. I ended up paying for his surgery out of my own pocket. All right, Henry. Do we show our audience the Deuk laser disc repair video?
Not yet.
Let's do that.
Copy that.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. So you can understand how this laser surgery gets the job done by cleaning out the tear, which is what I'm doing right now. So what you saw in the animation is what we're doing. We're using a laser to clean this scar tissue and herniation, which is the blue stuff that you're seeing, and granulation tissue, which is the inflammatory, painful inflammatory tissue, and sometimes bone spur, calcification, all of that stuff you saw on the video that we were removing, that's what we're taking out right now. It all has different colors, okay? The calcium is typically whitish colored, and it's flecks, it's little flecks, and they turn golden color usually when I hit them with the laser, like that right there. A little bit of calcification. And this white stuff is scar tissue from chronic inflammation that gets laid down by the process of inflammation, where you have fibroblasts that come in and make collagen. So what happens here in this disc is a cycle of new inflammation with old inflammation, scar tissue, calcium, reherniation, new herniations, old herniations, all of it living together in complete and utter chaos, causing pain and suffering for the patient. All right, questions?
These next two questions come from Ian on YouTube.
Hello, Ian on YouTube. Welcome to our live stream.
First question they ask is, can you narrate a little bit more about what you're looking at on the imaging?
Oh, sure. Yeah, I think I just did that actually. So right here, the laser is at 12 o'clock. It's the glass fiber. It's delivering energy to the tip. It releases right out of the tip onto the tissues. These tissues are all protein, and there are different types of proteins like collagen, elastin, proteoglycans, and some calcium, which is the golden stuff. But most of this is herniation and scar tissue right here. This is what we have to remove to get rid of her back pain. This stuff right here. It's a piece of herniation. All right. Other questions?
Next question coming from Ian once more, asking, can you explain what you meant by, quote, the knee in the facet?
The what?
Can you explain what you meant by, quote, the knee is the facet?
The knee is the facet?
Yeah, when you were going into her L5-S1, it was said.
Oh, sorry.
The knee is
I
the
understand.
facet.
Sorry about that. So, yeah, what I meant was the facet joint, which is located in the back of the spine, if you have pain from the facet joint, somehow it can be referred down to the knee. And so everybody in pain management knows that. And when the patient complains about pain radiating down their leg, if it goes down to the knee only and you're in the facet joint, then you know it's coming from the facet joint. So what we worry about is poking the nerve root. We don't want to poke her nerve root. The nerve root, if I poke it, the pain will go down to her ankle or foot. And so at one point she complained about that, and we took the needle out and redirected it and repositioned it, which is what you're supposed to do. And then that went away. And then when I came back and I tried again one more time to get into the disc at 5-1, I'm worried about hitting the L5 nerve root. I'm worried about hitting the S1 nerve root. And so I'm looking for pain going down the leg to the ankle or toe. She did not have it the second time I went in. She only had it to the knee. Hold the tube. Yeah. So when she said the pain goes down my leg, we said to where, and she said my knee. Well, that means it's not the nerve root. It means it's the facet joint. So we don't mind referred pain from the facet joint. That's not a problem. We're not going to damage anything and cause any deficits. We don't want to give her a neurological deficit. We don't want to give her a motor or sensory deficit. We don't want to damage the nerve root. So the way you know you're damaging the nerve root or too close to the nerve root is if the patient complains about pain going down their leg. That knee, I knew that wasn't the nerve root, that was the facet joint. And you can't really damage the facet joint. It's already damaged. So there's nothing you need to worry about there. Good question. So we are just about done with this first disc. This is the L4-5 on the left. We're going to do the L5-S1 on the left next. And then we're going to go to the right L4-5. And then we're going to go to her bilateral SI joints. Then we're going to go to her piriformis. So she has 1, 2, 3, 4, 5, 6 causes of back pain, 6. And the average is 4. The most common average is 4. Most people with chronic back pain have 4 very distinct specific causes. In her case, she has 3 disc areas, 2 sacroiliac joints, and the piriformis muscle on one side. Those are her causes. And did we show the 30 causes of back pain?
Not yet.
Huh?
Not yet.
Let's go ahead and show that so people can understand what I'm talking about
Copy that.
while we finish up this disc. I'm Dr. R. Deuk with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deuk Majan. Thanks for joining us. All right, welcome back. You can see that there are many causes of chronic back pain that are potential. Shot. The most common is the disc. Out. That's what we're fixing in this patient. We're fixing 2 discs, one of them on both sides, because she has tears on the left and right at L4-5, and both tears are problematic. So we can't just fix one because the other one will still hurt. Scope. Thanks. The second most common cause of this back pain that's chronic is the facet joint, F-A-C-E-T. See the pink tissue there? That's the painful tissue. I can't see with this headlight, with this light here. I can't see with that light there. Move it, pull it away. I need some light in this room. Nikki, you got to make sure this pedal is where my foot is. Don't just stand around. Verify the position of the pedal. Make sure it's where it needs to be. Any questions from our audience?
At this moment, no current questions.
All right, well, have you shown the video on how... Henry, you got to take over, man. I need
Yeah.
you to be a Howard Stern, okay?
Yes, sir.
Howard Stern doesn't sit around and wait for people to tell him what to say or do. He actually takes control of the situation.
Yes, sir. Is there anything?
So, yeah, I want you to push this dialogue along. I've done it a long time.
Copy that.
It's time for you to understand we do the same thing every time and just prompt it and go. So we've done what causes back pain, which
Yes, we
is
did.
the tear and inflammation. We've done 30 causes of back pain.
Yep.
Now the next one would be the DLDR.
Which we shown, yes.
Yeah. So go ahead and say, hey, let's show how your procedure is working. Or pick
Okay.
something else like facet pain. But
Okay.
mix it up. If there's no questions, it gets a little boring watching this over and over again. So throw in a nice video, tell us what we're going to see, and bring it up.
Copy that. So for this one, we want to show the. We want to show the.
Don't do that. Just figure out what you want to show and then say it.
Okay. Well, next thing we're going to show is the facetogenic neck pain of how.
Neck pain.
Yeah.
Back pain.
Back pain. Okay. Next video we can show is what is a microdiscectomy and how that is performed and why people should not be getting that.
All right, sounds good. So microdiscectomy would be another procedure that we don't recommend here, but like Henry said, it's one that's commonly performed and recommended for patients around the world. It's highly invasive and damaging to the disc, and it doesn't fix back pain. It only treats leg symptoms. Why is my foot getting cold as shit?
Is that Tony still there?
Testimonial.
Copy that.
And good morning, Dr. Deuk here, March 18, 2024, with one of my patients originally from Sarajevo, but now he's in Boston. And you came down to Deuk Spine Institute because you had some problems with your discs in your lower back. They were reherniated, degenerated, you've had back surgery before. Why did you come here to Deuk Spine Institute?
That's correct. First of all, thank you. Had a long history of lower back issues, had severe herniation about 4 years ago, and had microdiscectomy with laminectomy. Re-herniated it about a year ago, have had multiple steroid injections. None of that really helped. I was requested second opinion in Boston and a third opinion, and most of the surgeons that I saw in the Boston area said that either live with it, kind of deal with the pain management, or spinal fusion L4-L5. And I really didn't want to have a spinal fusion at the age of 45. I have 3 young kids, a lot that I want to do with them, and I found you online.
Let's talk about that.
Sure.
So this is important. They recommended an invasive surgery, spinal fusion, but they also recommended it just at L4-5. But you had 2 discs that were the problem. So imagine what would have happened if you had the fusion at L4-5. Would you have been fixed?
Yeah, I didn't want to find that out.
No, because your L5-S1 was also a problem, right?
Yeah.
And you would have to come back and get the second surgery. And that's part of the problem, is the wrong diagnosis and under-treatment by other surgeons. That's one thing Deuk Spine Institute does not do. We get all your diagnoses and we can do all the treatments at one time. All right, we'll carry on. What's life going to be like for you now that you've gotten your Deuk laser disc repair done?
Well, I'm hoping a lot more enjoyable and manageable. I've adjusted my social life significantly in the last year or so around the pain management, if you want. Removed a lot of activities that I enjoy. So I hope to be able to engage in those with my kids again. I know I've got a few weeks of healing ahead of me, but slowly, strictly following the instructions you provided.
More than a few weeks.
More than a few weeks, but 6 weeks of brace and up to a year of limited weight and whatnot. Beyond that, just kind of resume normal life if you want. And it's been difficult mentally as much as physical. I think a lot of people don't appreciate that pain management affects you often even far more mentally than it does physically, and those that are in your life, family members, get affected as much. So that's the part that I'm as excited about, that mental health, as I'm about physical health.
Getting out of pain management, that's really key. You know, getting a definitive procedure that fixes your problem. Now, you came here with back pain. Do you still have that same back pain, or is it gone?
No, it's just the back pain is more localized from where the incision is, and just a little bit of discomfort, but I all day long. I sit here with you virtually pain-free as we speak.
Good job. And you can see the surgery here. We did it last week, so you're almost a week out of surgery. You can see the laser cleaning up the tears and the herniation. You had 2 discs that need to be fixed, by the way. Your surgery went great. Anything else you want to say to your family, friends, fans out there?
No, the same as many of the other patients have said. Do your research. Do not follow the first line of defense given to you by your local service provider if you want. Just do your research. It's your back, and do everything you can to find the best care. I'm pleased I came to Dr. Deuk's Institute, and be happy to provide guidance and references to anybody that asks about it.
Well, thank you so much, and safe travels back to Boston.
Thank you, sir.
You're welcome. Welcome back. We are done with the disc here, and we're going to move on to the other side. Two down, 1 more to go. I don't want this. Just give me the... Turn on the light, somebody, like we always need. All right, do you have any questions?
At this moment, no current questions.
Excellent. Let's go. Guide wire. Where's the dilator? Shot. We try to get the mallet impactor. Try to get the right thing in view. Shot. Okay, do you see the pelvis and the bladder and the hip and everything? What does that tell you?
Am I moving it?
Tells you you're too low. Shot. I'll do it. Shot. Let's go. Back it up. You don't have to do one movement then the next. It can be all be done at the same time. Blue towel here. Grabber. Laser.
At this time, we wanted to present of how a laminectomy is presented and why it should be avoided at all times.
Yeah, thanks, Henry. That's a great point. Laminectomy is another popularly recommended back surgery that we do not recommend at Deuk Spine because it's so invasive, bloody, damage to the muscles, and more importantly, it doesn't fix back pain at all. Laminectomy was originally designed to remove tumors out of the spine and first performed by Victor Horsley in the 1800s to take a tumor out. But it was a good procedure for a while before we had these more advanced technologies, and it was used to treat primarily neurogenic claudication, which is pinched nerves from stenosis, causing leg weakness, numbness, pain with walking and standing. We don't recommend it anymore because, well, quite frankly, we have better treatments like the Deuk laser disc repair that are far less invasive. So let it roll, Henry. Let's take a look at what a laminectomy is.
Yes, sir.
Well, you can see from the video that laminectomy is very invasive and involves muscle damage, removing bones and ligaments that are necessary to stabilize your spine right out of your spine. Of course, that explains why a lot of people who have laminectomy don't get better and why they need more invasive surgery. With the Deuk laser disc repair, there's no laminectomy being done. We're not taking bones or ligaments out of your spine. We're just literally going through a tiny little opening in the side that's already there. So we don't have to make any additional cuts. We don't have to remove any muscle, bones, or ligaments. Just about done with our Deuk laser disc repair. We're going to end the broadcast. We're going to move on to the next surgery, which is a bilateral sacroiliac joint Deuk plasma rhizotomy. Our patient doesn't just have disc pain, she also has pain from her SI joints on both sides. And we're going to go in and basically get rid of the pain nerves to those joints. It's called a rhizotomy. And we do a special type of rhizotomy at Deuk Spine, available here and nowhere else. It's patented. All right. Any other questions?
At this moment, no current questions.
Great job, Henry. Why don't we end the broadcast?
Copy that.
And we are pretty much done here. I'm just going to zap these last few pieces of scar tissue inflammation. And we're going to come on out. And we're done with the bilateral L4-L5, L5-S1 Deuk laser disc repair. You can end the broadcast and recording.
Copy that.